Yes, I understand the concern, and no, it's not a direction I asked her to pursue. Obviously, there's been a lot of emotion in the COVID debate from the beginning, and that's entirely understandable. People have been understandably anxious about both the disease itself and the damaging effect of restrictions. With respect to the announcement made by Dr. Hinshaw last week, this is something that she and her team in the public health branch of the Department of Health, all of them professional members of the Permanent Public Service, developed over some time, presented it to our COVID Cabinet Committee, I believe on July the 8th, and we accepted without modification the proposal that came forward from the Chief Medical Officer of Health, which is based on science and data, particularly on the powerful science and data behind the protective effect of the vaccines, which has, as she says, dramatically changed the context of COVID-19. So to quote Dr. Hinshaw herself, she said, quote, "I care deeply about the health of all Albertans. This means I have to constantly consider not just COVID-19, but all of the other threats to people's health. The majority of our public health resources have been directed to the COVID-19 response, as has been necessary. That has come at the cost of not fully working on other threats, like, for example, opioid deaths. As vaccine coverage has changed the nature of the province-wide risk of COVID-19, it is, in my opinion, time to shift from province-wide extraordinary measures to more targeted and local measures. This allows us to start looking at other issues while still continuing COVID-19 protective measures." So again, this was a package of measures that came forward from the Chief Medical Officer and her team. We respect their data-driven scientific advice, and that's why we accepted the advice.
Alicia?
Hello?
We can hear you, Alicia. Yep.
Yeah, okay. So my next question is actually to question, HBO and Disney, these are multi-billion-dollar industries. I'm wondering why tax credits are so important to draw them. Shouldn't our lower dollar and beautiful scenery be enough? Why do they need the tax credit?
Well, fair question, and those are questions that I and other ministers asked when we were reviewing this policy, because we have so many natural advantages here. Obviously, our scenery, our highly trained workforce, our low tax rates, and all of it together. But we were punching below our weight when it comes to this growing industry, partly because we were competing with other jurisdictions that have very strong built-in incentives, very generous tax credits and other incentives. In the Canadian context, we were competing specifically with Vancouver and Toronto, or Ontario and BC, that have had much more generous incentives than Alberta for a long time. And in a continental context, we were competing with states like Georgia. In fact, I remember sitting down with Jay Rowe, who you just heard from HBO back in January, and he walked me through the kind of very careful math and financial analysis they do in choosing a location, and said that with the changes that we had made, we were now, I think he said, a couple of points ahead of Georgia, which was a big deal because Georgia has been the big magnet for large-scale productions in North America in recent years. So, look, the general philosophy of our government, and I believe most Albertans, is to have the right overall economic conditions to attract new job-creating investment. But we do acknowledge that in certain industries, and film and television are one of them, you've got to at least meet your competition, and that's what we've done. So what's happened here, actually, I think our incentives are still not as strong as other provinces and states, but the tax credit now allows us to compete with all of the other big advantages that you've talked about, Alicia, like our scenery, our workforce, and the good economic conditions.
Operator, can you please put through our next caller?
Next is Emily Mertz with Global News. Go ahead, Emily. Thank you so much for taking the question. So the province has explained the need to spread health resources around to demands that are not COVID related. I'm just trying to understand the decision to remove the mandatory isolation of COVID positive individuals from a resource perspective. So did that part of the COVID response require a lot of staff or resources? Can you explain what's behind the decision to move from mandatory isolation of positive cases to a recommended?
Sure. Thanks for the question. First of all, with respect to resources, I want to be clear. This government has spared no expense in defending Albertans' health throughout the COVID crisis. In fact, last year we spent $1.5 billion on top of the $20 billion health budget just for COVID-related health care. And we've added another $1.25 billion for our COVID health contingency in this year's budget. So that's $2.75 billion, approaching $3 billion of COVID-related health spending alone. And if additional spending was necessary, we would be there to provide that money. There's no doubt about that. So it's never been a question of financial resources. What Dr. Hinshaw articulated in her announcement last week was the need for our public health infrastructure to deal with more than just one disease. There are many challenges to health. She's expecting, as she said, a significant season of influenza, flu and cold. Needs to be able to deal with that, as well as obviously the opioid crisis that took over 1,000 lives in Alberta last year. In particular, I think Dr. Hinshaw is concerned that anybody who might have minor symptoms of cold or flu, if all of them are automatically put on 2 weeks of self-isolation, that can be very disruptive, and so she's taking, and also I think she's pointed out that there was essentially no enforcement of that particular legal requirement, but there remains a very strong recommendation for anybody who is symptomatic, or obviously anybody who tests positive for COVID-19 to stay home. Let me quote Dr. Hinshaw. She said that, quotes, "We will not eliminate COVID, which means we need to learn how to live with it. Testing every person with a runny nose or sore throat is an extraordinary measure that we cannot sustain, particularly through the respiratory virus season. Legally mandating everyone to stay home for 10 days if they have any symptoms is also an extraordinary measure. It was necessary before vaccines, but it is also incredibly disruptive. It could only be justified when the risk was unchecked by vaccine protection. I know the vast majority of Albertans do not want to knowingly inflict harm on others. I believe that for those who test positive for COVID-19, knowing that staying home is the way to protect others and is the right thing to do will be enough for them to take that action," unquote.
Emily, do you have a follow-up question?
I'm just wondering, based on that response then, if you feel that Alberta has high enough vaccine uptake that should we see this in schools? Should we see cases, in schools if there's no requirement for positive cases to isolate? You're confident that we won't contribute to a fourth wave?
Well, we do expect cases to go up and to go down. Dr. Hinshaw has said, as have I, that we expected after lifting public health restrictions that we would see an increase in cases, just as we've seen in other provinces and other jurisdictions around the world. And as we both, Dr. Hinshaw and I both have said that we expect to see an increase in cases in the fall based on seasonality, but that will likely be concurrent with an increase in flu and cold cases as well. But I am confident, we are confident, obviously, that the powerful protective effect of the vaccines is a complete game changer. We now have 2/3 of Albertans fully vaccinated and over 3/4 who have received at least their first dose. These are levels that are almost unprecedented in the world. They're a little behind the Canadian average, but they're well ahead of the international averages. And in this respect, let me quote Dr. Sarah Fortune, who is the chair of the Department of Immunology and Infectious Diseases at Harvard University. She said last week that, quotes, "Alberta is taking reasonable steps in the face of having done a good job of bringing the viral numbers down and in the face of good vaccine coverage. I don't think the people of Alberta, where you've achieved upwards of 70% of vaccine coverage, need to think that they're going to become the next Louisiana, where vaccine coverage is much lower," unquote. With respect to schools and children, you ask a very important question there. And it's important to highlight that the risks for children posed by COVID-19 are extremely low. They are lower than for the typical annual flu. As Dr. Hinshaw pointed out, for kids, we saw more children hospitalized in intensive care over the 7-month flu season of 2019-2020 than we have through the 17 months of COVID-19. She also points out that kids aged 5 to 14, had a 140 times greater risk of an emergency department visit for a sports-related injury in 2019 than their risk of COVID-related hospital admission since March of 2020. So we don't talk about shutting down kids' sports because, unfortunately, some kids get injured and have to go to the emergency ward. A tiny fraction of that number end up having to visit a hospital with COVID-19. I think it's also important. There's been some, I think, let me just be charitable and say inaccurate information that has about the impact of COVID on kids. It's important to recall that in Alberta, over the 17 months of the disease here, we have not recorded a single COVID-related death for any Albertan under the age of 20. And the vaccine coverage just reduces the chances of children becoming sick or experiencing severe symptoms radically from where we were 6 and 12 months ago.
Can you please put through our next caller?
Next is Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon, Premier. Just have a couple of questions. One is concerning comments that have been made over the weekend and in the latter part of last week when the mayor said he was freaked out, quote unquote, after the announcement by Dr. Hinshaw and other councillors, including somebody running for mayor, Councillor Jody Gondek, has made certain, comments probably even more so than the mayor, and even wanting to hold an emergency meeting to reinstate the city's mask mandate because of what's happened. So how do you react to all that? You answered Lisa's question about how you understood there was some anger, but what do you say to the mayor who is freaking out and a councillor or more than one councillor who is also expressing grave concern?
Well, I think it's regrettable that we've seen comments attacking the expertise of our brilliant Chief Medical Officer of Health. I do recall a time not that long ago when the same mayor wore a T-shirt saying, "What would Hinshaw do?" Well, what she would do is the policy of the government of Alberta. This was a package that came forward from the Chief Medical Officer of Health and her team based on the evidence, both here and around the world, of the changing nature of the disease given widespread vaccine protection and a careful analysis of the risks and benefits of extraordinary, almost unprecedented government intervention versus the diminishing risk posed by the virus given the powerful effect of the vaccines. So I guess I would say that this is a government that respects the advice of our scientific experts, of our Chief Medical Officer of Health, that is following that advice, knowing that that advice is based on hard data and science. And I would just encourage others in positions of authority. I can understand that from time to time there's going to be disagreements about aspects of policy, but I would call on anybody in a position of authority, especially elected leadership, to show a degree of respect for the Chief Medical Officer of Health and for the advice that she provides.
Do you have a follow-up today, Rick?
Yes. I realize cities have their own jurisdiction with regards to some of this COVID stuff, but there is a request from more than one councillor to consider reinstating a mask mandate in Calgary. I realize that they're allowed to do this, I gather, but what are your thoughts on the necessity for a mask mandate?
Well, in fact,
Again.
sir, well, I'll tell you what the views of the Chief Medical Officer are, and as endorsed by the government, and that is to lift the mask mandate for ride shares, transit, and taxis in mid-August when we reach to the next stage. That's the advice that we have received based on the widespread protection of the vaccines. And I would encourage municipal councillors to respect the expert advice of the Chief Medical Officer. I don't know how a city councillor believes that they have a greater insight into the public health challenge than the Chief Medical Officer of Health and the Public Health Division of the Government of Alberta, who is responsible for this work. So I think we should focus on the science and not allow these issues to be politicized. I would point out, Rick, that the same councillor is somebody who didn't want to lift the mask mandate in Calgary whatsoever, and was ultimately defeated. So I know that there are some people who, look, I respect if there are individuals who feel that in certain contexts it makes sense for them to wear masks, that's fine. I respect their choice. And we do call upon people, certainly, to mask themselves if they are in a high-risk context, like a continuing care facility or a hospital, obviously. But the advice of our public health experts is that outside of those contexts, masking is no longer a necessary, or rather, it's no longer a necessary public health intervention. And look, the science is very clear. We have one of the highest levels of vaccination in the world. And let me just drill down on that a little bit, because it seems to get lost in all of the political noise. But the data out of the United States is remarkable. They have 163 million vaccinated individuals, fully vaccinated, of whom 6,600 are in hospital. That's 0.004% of Americans who are fully vaccinated are in hospital, and 3/4 of them are very elderly. In terms of people who get symptomatic infections in the United States, out of the 163 million fully vaccinated people, 0.09% end up being symptomatic, and those are almost always minor symptoms. Now, we have 2/3, and I believe we'll shortly, within foreseeable future, we'll have 3/4 of this population fully vaccinated, meaning that effectively COVID does not pose a risk for 99.999% of that population. It's time to follow the data. It's time to listen to the science.
We have time for about one more question. So with that, operator, can you please put through our last caller?
Final question is from Andrea Williams with CBC. Go ahead, please.
Hi, yes, Andrea Williams with CBC. My question would be for Premier Kenney in French, if that's possible, but then you could answer in English as well. Hold on a second, please. Okay, so il y a des manifestations depuis 5 jours à Calgary et Edmonton à cause de la fin annoncée de toutes les dernières mesures sanitaires. Qu'est-ce que vous répondez à ces opposants?
Je respecte les perspectives des personnes, mais enfin, comme Premier ministre, il faut que je suive le conseil de l'officier de santé publique, le Dr. Hinshaw, qui a proposé les nouvelles.
All right, you have been listening to Alberta Premier Jason Kenney, who is facing a lot of questions regarding last week's announcement by his Chief Medical Health Officer, Dr. Dina Hinshaw, that they are lifting a lot of restrictions and the need for masks and the need for testing and tracing, and he got a lot of pushback last week. Well, today, the Premier says that they are